Okay, so these novel movements of the spine are not for repetition's sake, but more to start to learn and feel the back. So this is more of a brain exercise than a body one. So we want to slowly move through these movements and try to consciously be aware of what the low back is doing. Can you feel the joints opening, closing, changing position? So really try to focus in and feel the movement in these areas. What we're trying to do is almost update the map of the brain about the low back and how it moves in space. So the more novel the movement, the better. We don't want to move into any painful areas or really uncomfortable areas, so modify these movements and make them less if they become too much or too strong. In this case, we're trying to bring the shoulder and the hip together on each side, and they're just movements that you wouldn't typically do, and we're trying to show the brain that some pain-free movement is possible, especially if you're suffering with ongoing issues. We can then combine these movements into a circular type fashion and try to coordinate flexion, extension, rotation, all through the spine and the pelvis, and get as much softness and fluidity as possible. What's really important is you start to learn to let go of the muscle tissue and stop bracing, because it's quite normal when you're in chronic pain to put a brace almost through the spine. If comfortable, we can then also start dropping down into extension, but just be mindful that it doesn't aggravate any symptoms. Moving from flexion to extension, nice and slow. It's normal to have some tension at the end range of that extension, and this is just normal as the joints are closing up. And then when laying on the back, we can trial lots of different movements to see what the back does and how it feels. Just simply rotating the hip to start with. We can do knee hugs on either side. And then we can also go into different stretch type positions. And I almost want you to have a play with these movements. Feel what's comfortable, feel what's possible, but ultimately go for pain-free and try to make them as novel as possible. This last pelvic tilting exercise, you'll notice as the back arches, the chin comes in, and as the back flattens, the chin goes up. And it's this coordinated movement between the neck and the low back that we're really looking for. Slow and smooth, and get the pelvis to move in synchrony. We can then also just do some simple stretches to finish, dropping over and around for repetition. My advice is to put a 5-minute timer on and just work through these movements slowly and comfortably.